All right. Good morning, everybody, and welcome back to another exciting episode of the lab. With me here today, actually, creator of the Athlete Lab, is is Dr. Trent Nessler. Thank you for
Howdy.
joining me here this morning, man.
Yeah, thank you for having me.
No, so the reason I wanted to bring, do we call you Trent or Dr. Nessler?
Just call me Trent.
I'll call you Trent. So the reason I wanted to bring Trent on here is one of the gaping holes in the lab right now is that we haven't really had anyone come on and talk about martial arts. So who better to come on
Hmm.
and talk about that than you, right?
I
Um,
appreciate that.
I see a lot of your social media posts. I mean, you're
Yep.
always in the gym working out. I mean, you're kind of like the paragon of work-life balance in regards to
Yeah.
personal fitness, and then also practicing what you preach.
Yep.
Uh, that is a huge thing. I think that sometimes new grads kind of lose is they want to
Very
prove
much.
themselves and want to, like I can do this job, like I can show I can see as many patients as possible, and then ourselves kind of go off to the wayside.
For sure.
We don't take care of
For
ourselves.
sure.
Um,
Absolutely.
but
And
but
it, and it too, it says a lot to your patients too. I mean,
mhm,
when you keep your own health and your own mental health in play, you're more present for your patients. And two, it's hard to talk to athletes about certain things physically if we physically can't do that. I think it's always a good representation of the profession if you're also on top of those things as a PT.
100%. I mean, how many PTs or PT students have you seen that can't demonstrate a squat,
Yeah, for sure.
right?
That's like the heavy set cardiologist telling you to go on a diet. Okay. It just doesn't work.
No, a little hypocritical, right?
Yeah,
But so Trent, give me a little bit of a background on what brought you to where you are now at the Athlete Lab.
sure.
The Athlete
Yeah.
Lab is.
Yeah. So I'm a PT. I've been a PT for 25 years. I started out very early in my career treating ACLs. I had a practice in Phoenix, Arizona. Actually worked a lot with Major League Baseball. Actually, my first 3 years clinically was heavy into shoulder rehab. Got to work with Major League Baseball pitchers and catchers for 3 years. My clinic was located right across the street from the Seattle Mariners training complex. So I had a really good upbringing around sports medicine from a very early onset in his career. And as I was treating these young kids having ACL injuries, I was seeing certain movement patterns that intuitively I knew was bad for them. So I actually went back to do my doctorate now, keeping in mind this is at a time where the DPT, our program was the second one in the country to actually start the DPT. So at that time, it was not anything like it is today.
Mhm.
It was really more like a PhD. I took a total of 75 credit hours. It took me 3 years. I would go work up to Friday every week. Friday afternoon, I'd leave, drive 2 hours to the university, and then go to class on Friday night, Saturday, Sunday, drive back, and then see patients on Monday. I did mine with a focus in biomechanics and motor learning to really I came from a strength conditioning background. So really, I knew that if I could evaluate somebody better, that I could treat the movement patterns that I was seeing that I knew intuitively was putting me at risk for an ACL injury. So started
Mhm.
down this long road, filming people, worked with various technologies. Fast forward 2015, I actually partnered with a wearable sensor technology called Dorsa, and we created what is known today as the vMove Plus AMI. Since we originally launched that back in 2017, we now have systems in 5 different countries, and we have data on 90,000 athletes across 5 countries.
Wow.
So, what it's done for me, and that goes into why I started the Athlete Lab, is the Athlete Lab is named the Athlete Lab because it is a functioning research facility and a PT clinic. It's a cash-based practice. And a lot of what I do is I have had the privilege of being exposed to a lot of different various technologies and a lot of different approaches. And because I have an objective movement assessment and a tool by which I can go and do data analytics on, it's allowed me to really see what tools are the most effective for truly improving sports biomechanics. And so what I've done at the Athlete Lab is I've combined all of that stuff that I've seen over the years that has had the most impactful impact to the way that people move and permanently changing the way that people move was really important to me. And so the Athlete Lab is not only, a cash-based PT practice, not only is it a functioning lab, but it's an incubator for development of innovative ways to advance what we currently do. Because, the stats, unfortunately, are horrible. An ACL, and there was a good King study that was published 2018 that showed that an ACL reconstruction, when they go back to sport at 9 months, they still demonstrate the same biomechanical risk factors that they had at the beginning.
Hmm.
That tells me is that as PTs, we're not addressing that. And if the burn went a step further and showed that those same biomechanics are still present at 2 years, so they don't just go away. You've got to train that. And so
Hmm.
that's part of what the EMI was designed to do, is to draw that out, make it objectively measure it,
Hmm.
so that you can really test out the effectiveness of your approaches, and had a truly impactful impact on sports biomechanics. So that's kind of how the came to the lab. It's been a lot of curves in the road as I go. I mean, I started in Phoenix, Arizona.
Hmm.
I got recruited to Nashville, Tennessee. Was here for a number of years. I got recruited from there to Birmingham, Alabama. Was there for a number of years. Then came back to Nashville, and then started the Athlete Lab. Opened my doors exactly 2 months ago, as of yesterday.
Nice. Congratulations,
Yeah,
man. That's
thank
awesome.
you. Thank you very much.
Dang. So you brought up sorry, I just had I guess a light bulb click on.
Yeah,
You were talking about when the ACL mechanics are like the way that they are, I guess would you say post-surgical, and
yeah.
sometimes people aren't doing like their due diligence in the clinic. Do you think that's because there's a lack of education to begin with, like in the school
You
system,
know,
or
yeah,
is it more just
it's
like
a
how people take it, like loading?
um I, I think it's several fold. Um I think that as a profession we need to have, and it's funny, and this is not a sales commercial for my course coming out. But I'm putting out a course
Hmm.
on ACL rehab and ACL injury prevention, a movement-based approach.
Cool.
Because the biomechanical literature, really, quite honestly, has been published since early 2000s. And here we are 24 years later, and we still are addressing things the same way that we did back then. And
Hmm.
so, what I think is that we need to have a much more movement-based approach to how we do rehab. And that is, there is some form of isolation to that. There's also a lot of closed kinetic chain to that. There's neurocognitive training that goes along with that. There's application of BFR that goes along with that. I mean, there's a lot of different pieces to that.
Hmm.
So I don't think it's really a lack of education. I think it's again applying all of those things and all those tools and all those little things that you can do to truly impact human movement. And two, we're learning a lot more. It used to be that dynamic valgus was the big thing. It still is the big thing. But
Hmm.
what we've found is that it's not only dynamic valgus, the magnitude of the movement, but
Hmm.
the speed at which you fall into that dynamic valgus. The greater the speed, what I can tell you now is that the greater the speed of dynamic valgus, it means you got more links in the chain that are involved in falling apart. The
Hmm.
other thing is the position of the pelvis, because if this is your stance leg and you move into a retro Trendelenburg position, your center of mass goes this way. When you land, it creates a force vector that drives your knee into higher degrees of dynamic valgus.
Hmm.
If you're on the other hand, if your pelvis falls this way and you move into a Trendelenburg on this side, your center of mass is this way, you're much more likely to lose your balance. So then you end up getting those athletes that jump up in the air and they land, they hop, 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 till they're stable,
Hmm.
because they're chasing their center of mass till they get underneath it, and then they're stable. So
Hmm.
I mean, we've learned so much about just general body biomechanics
Hmm.
because we measure so many data points.
Mhm.
Is it perfect yet? No, it's not perfect yet, but it's a heck of a lot better than what it used to be. And the data that we've captured from it has been so incredibly useful.
Okay. Shoot. So in terms of I guess updates to the research then, what would you want to see looked into more of?
I would like to see more looked into, a lot of different things. Number one is speed of dynamic valgus. Like, what are I know based off our normative data,
Mhm.
what are kind of outside the norms. We've got normative data on 10,000. So I
Mhm.
know what kind of for a single leg squat hop and in a multi-directional hop, I know what those normative values should be, but I
Mhm.
would love to really take a deeper dive into that. I'd love to take a look and see the impact of speed of pelvic loss. So
Mhm.
we measure both magnitude of how much your pelvis moves, but also the speed at which your pelvic moves. We don't
Mhm.
have that normative data yet. I'd love to see the impact of concussion on dynamic valgus
Mhm.
and pelvic control because I know it's a big impact.
Yeah.
We know that if you have a concussion, you're 3 times more likely to have an ACL injury up to 3 years post concussion. And what we see in our data is that, those who've had a history of concussion actually have larger degrees of dynamic valgus and their speeds are much higher. I'd love to dive into the TSK-11, Tampa Scale for Kinesiophobia 11 form, and really start to isolate out questions that correlate to movement because I believe there's a connection.
Mhm.
That if you score poorly on, let's say, question number 4, then you need to improve your performance on a single leg squat. Like I think that there is that connection there. We're doing that right now. We measure the TSK-11, we measure movement. What we're not doing is measuring movement by question yet.
Mhm.
But I think there's a strong correlation there. There's so many unanswered questions in my mind
Mhm.
of the whole complexity of the problem. I think that we've tried to standardize it to and try to make it too simple when it really is individualized and it's complex.
Mhm.
That being said, it doesn't mean that our treatment protocols have to be super complex. You don't have to
Mhm.
be standing on a ball and having 7 people pull on you in different directions and all this other stuff.
Mhm.
You know, Basically stabilize a single leg squat, stabilize a multi-directional hop, and
Mhm.
if they can't do it, find out why. Is it because when they land, their pelvis is rotating? Okay. So then you need to look at quadratus lumborum. You need to look at internal obliques. If their pelvis is falling, you need to look at their glute medius and quadratus. You need to go back to origin and insertion and
Mhm.
see what is the stabilizing muscles in that motion and then attack those particular things. And that's what I'm trying to do with the athlete lab is get that granular with it
Mhm.
because it makes a huge difference.
Right.
Re-injury rates are 27% for ACLs. Do you know how long it's been 27%? It's been 27% since I started reading papers back in 1999.
Ooh.
So it's not changed. That's the sad part. So we got to get better we got to get better at rehab and we got to get better
Mhm.
at making more informed decisions for return to play. And
Mhm.
that's really kind of what I'm trying to do with the athlete lab. I mean, a big part of my business
Mhm.
is like just this week alone, I did 7 return to play assessments. A big part of what I do is
Mhm.
is return to play testing.
Okay.
That was a long-winded answer.
No, but I love that. And actually, I have another follow-up question to that.
Sure.
So then what about like looking into the athletes that like require being in like a valgus position? So like looking at like a skateboarder who will like land and they have both
Yeah.
into that valgus position, or a skier who has to utilize that dynamic
Yeah.
valgus position.
And I think that's okay as long as you control it.
Yes.
That's the key is the control of that motion. And I'm not so much focused on the magnitude because that's what I used to focus on was the magnitude of dynamic valgus, but
Hmm.
it's really the speed. Because if you look at all of the physics calculations and things that are related to force and
Hmm.
torque, there is a speed component to it. So the higher the speed goes, the more torque and the more force that you're putting through the knee and through the meniscus and through the ACL. And
Right.
so for me, it's been a big aha moment is when we started measuring speed of dynamic valgus. Because what I find is that speed of dynamic valgus is actually a bigger indicator than degree. Because you can stand up and put your knee at 20 degrees of valgus and it doesn't hurt you. But if you
Hmm.
did that at 350 degrees per second, you're probably going to tear something.
Hmm.
So the speed factor is big
Hmm.
in
So do
my
you think
mind.
it'd be worth looking into like how like skiers train or how maybe a skateboarder might train and kind of see how they do go about like learning how to control those forces?
Yeah, I do, but at the same time, there is still a high number of ACL injuries in skiing.
True.
And so what I like to do is I like to look at the biomechanics across all sports.
Hmm.
And what I will tell you is that if you improve your stability of your pelvis, you improve stability of your foot and your ankle, and you improve stability and control of your dynamic valgus, no
Hmm.
matter what sport you're in, you're going to improve.
Okay.
The other factor that I want to really start measuring, that we're starting to measure now, but we're not reporting it out, is power variance between your right side and your left side. So we have two measures that we use. We have LSI, limb symmetry index, comparison
Hmm.
right side to left side.
Yeah.
And then we also have LQI. LQI is limb quality index. And that is basically biomechanical factors that we look at as a measure of the quality of the movement that you're performing during that task.
Hmm.
So LSI, to your example, you can have an athlete that jumps up on a box and they land and both knees go in equally into dynamic valgus. Now, we might say that that athlete is symmetrically, they're at 100%. But we would also agree if that's a volleyball player, basketball player, that athlete is a high risk for an ACL injury.
Hmm.
So, how do we delineate that out? So, and that's where LQI comes in.
Hmm.
LQI is really important. But the other piece of that is the I believe that there is a factor of LSI in force output. So both force over time, so the amount of force that
Hmm.
each side can generate, I feel like there is a percentage variance between the two sides that starts to put you at risk. I also believe that over time, if force drops off by X factor and the other one drops off by Y factor, that you're going to be at greater risk. Easiest example of that is, my last scenario I was working was with police and fire. You get a firefighter who runs up to the top of the stairs and he's completely gassed. He's at greater risk for an injury. It doesn't matter. So
Hmm.
what is that percentage of power drop before you start becoming at risk? So you can measure that with a sensor, because as long as you got the person's body weight, as long as you got flight time, you can actually measure on hops and multi-directional hops, you can measure power output variance.
Hmm.
So I believe there is a measure there that
Hmm.
would indicate a risk factor. What that is yet, I don't know.
Huh. That sounds like it's gonna be a lot of fun.
This is why I love what I do, because there's always questions to be answered, right?
Hmm.
It's a constantly, and I think that that's where sometimes we fail as a profession, because we get into our zone and we get doing what we're going to do and we just
Hmm.
focus on what we're doing, and we don't start thinking about the other questions that we need to have. And as true scientists, we should be always constantly questioning, like, what's the best way to do that? Okay, I'm doing good now, but how do I make it better? And so, one of the things that I do is every single month I've got it on my calendar on a certain date. It's usually the second Tuesday of every month, to pull current journal articles and review the literature. And the percentage of PTs that do that is less than 1%. Scary.
That's not good.
That's not good.
I
So
didn't
if
think
you're
about that.
listening to this and you're pulling research, you're in the top 1%.
Holy cow. That's actually really bad.
I know, right?
Ah, holy cow. All right, man. So what I want to do, I'm going to kind of change gears on you here a little bit.
Yep.
So tell us a little bit more about your athletic endeavors. So I know on your
Yeah,
Instagram, every once in a while, actually not every once in a while, pretty much every other time I look at your posts,
yeah,
there's jujitsu posts on there. So
mhm,
one of the things I
yeah,
wanted to kind of talk to you more about is the martial arts and physical therapy.
sure. So, I got involved in treating mixed martial arts uh, probably 15 to 18 years ago.
Hmm.
Back when I was in Phoenix, Arizona, and this is really before the time of the UFC came out.
Hmm.
Mixed martial arts was still a backyard event. So
Hmm.
in Phoenix, it was pretty big because we had a lot of, and you can still see these on YouTube today. But there was a lot of backyard events where guys would, get a cage or they'd, put up a ring and they would have these backyard fights basically. And typically they were, mixed martial arts. It was a combination of Muay Thai, boxing, wrestling, etc. So this is really before, UFC really took off. So I was seeing a lot of these backyard brawlers, basically is what I call them, in my clinic. And so I really wanted to get a better understanding really of boxing injuries and those kinds of injuries. So I started training Muay Thai at that time. This was again 15, 18, it was 2004. So it's been quite a while.
Jeez.
So fast forward, I have a young son. He's starting to get bullied a little bit. He was about 8 years old, and I wanted to teach him a martial art. So he and I enrolled in Brazilian Jiu-Jitsu back. It's been 12 years now, and so we enrolled back in Brazilian Jiu-Jitsu 12 years ago.
Hmm.
And as a PT, I was fascinated. Like it was every provocative test you've ever learned taken to extreme. Like, I tell PTs all the time, there's no sport known where you take every single joint to its in range of motion and you make it break or you make them tap. And not only do you do it once or twice during a practice, but you do it multiple times during a practice. You do it sometimes twice a day, sometimes 5 days a week. And so the wear and tear on the body is huge. From a practitioner standpoint, it taught me a lot about biomechanics. So, I've been training for 12 years. I got my black belt last year
Hmm.
in Brazilian Jiu-Jitsu. For those that don't know, it takes about 11 to 12 years to get your black belt. And so, as a black belt PT, I'm one of the only black belt PTs who also has. There's one other black belt PT who's a new PT in my market, but I'm the only one with 25 years of clinical experience. And so, I started, several years ago,
Hmm.
treating jujitsu athletes from my gym. That's where I'm at right now. We've got a very large gym in Middle Tennessee. Our gym, we have about 600 students here. Most gyms usually have like one. You're lucky if you have two black belts.
Hmm.
I am one of 30 black belts at this gym. Our professor, the owner of the gym, is a special forces instructor for level 4 combatives training for special forces. So we get a ton of police officers, a ton of firefighters, a ton of
Wow.
first responders. And so as a community member, as a PT, I felt like it was important for me to get back to my community. So,
Hmm.
initially when I first started out, I would just come to the gym and I would see people at the gym.
Hmm.
Hey, their shoulders bothering them. Can you take a look at this? Yeah. So that spawned into me and the owner of the gym starting a business called Combat Athlete Science Institute, where I wanted to be able to provide some education to athletes. We designed our own BFR cuff for Brazilian Jiu Jitsu. It looks like a Brazilian Jiu Jitsu black belt. And I partnered with Normatec and Hyperice to develop recovery rooms for jujitsu gyms. Because at our gym, we put in a recovery room. We've got a recovery room here. We've got two full Normatec compression sleeves systems. We've got the hypervolts. We've got the vibrating rollers. We've got a whole slew of stuff. And what we found was about a 40% reduction in our injury rates with people who use the recovery room. Now it is one of the most popular things that we have at our gym. And it's actually become a good recruiting tool for new members. So every time some new member comes in, not only do they get exposed to our gym, but they also get exposed to our recovery room.
Wow.
So it started to, I'm like, holy cow, like this is like treating CrossFit as a PT. This is like treating CrossFit athletes on steroids
Hmm.
because like everybody's injured like all the time, and like right now we're in competition season. So,
Hmm.
as a PT, I started doing covering our competitions for our team. So I
Hmm.
go to every competition that we're at. I set up a table, take my Normatec compression sleeves. I take class 4 laser with me. I take some tape, all that stuff. And, sometimes a competitor may have their first fight at 10 o'clock. They may have 4 additional fights that they have to do. So they come
Sure.
off the mat. If they got tweaked a little bit, they come up to the table. I'll do some stuff on them to prepare them for their next fight. So it's after seeing that and after seeing the need for that market, that's one other thing that really spawned me to start the Athlete Lab. The Athlete Lab, my gym, I've got 12-foot by 12-foot wrestling mats. So, I would say on a daily basis, I'm on the mats at least twice, 3 times during the week. I'm putting a gi on. We're getting on the mat. We're going through different techniques, going through different positions that bother you. It's your knee shield or it's a knee slice pass or whatever. We're going through different techniques and really working through, okay, this is why it's bothering you. Here's what we need to do from a treatment perspective. Here's some stretches we need to work on, strengthening we need to work on, and here's some technique modification you can do to help you still accomplish that pass without hurting your meniscus. So those who treat combat athletes is minimal. There's
Hmm.
not a lot of people out there. I'll tell you,
Hmm.
I started really doing this on Instagram quite a bit a couple of years ago.
Hmm.
Since then, man, it's just you're seeing PTs pop up everywhere, and quite honestly, there's some of them that are, if you are into this, follow Dr. Kickass. He is a PT, OCS, also Brazilian Jiu-Jitsu black belt. There's a grappling doc out there. He is a purple belt out of New York, also a PT. Dr. Abbasi, orthopedic surgeon that covers the UFC. So there's a lot of good resources out there. What I find is that, if you are a PT and this is a population you want to get into,
Hmm.
number one, the athletes need it because right now what happens is an athlete goes into a PT clinic and they're like, oh, hey, what do you do? What's your sport? And they say, oh, I train Brazilian Jiu-Jitsu. And they're like, so is that karate? Is that Krav Maga? And immediately you have offended a Brazilian Jiu-Jitsu athlete because you can go to karate, no offense, and get a black belt in 3 years. If you get a black belt in Brazilian Jiu-Jitsu, you have spent over a decade on the mats,
Holy
at
cow.
least 3 days a week. And there's pride that goes along with that. And getting clinicians who understand simple terminology like De La Hiva or spider guard or open guard or close guard, just simple concepts that we do that
Hmm.
we have problems with, is immensely helpful. And that's part of the reason that as I was sharing with you earlier, part of the reason I launched the course that I did
Hmm.
with Northeastern Seminars on treating the combat athlete. The
Hmm.
course is designed to help PTs who want to treat combat athletes. It's a very basic course, simply going through general terminology, because I feel that some of the courses that are being put out there are too far advanced. It's not a stepping stone for the person who wants to get into this. What I
Hmm.
want to do is I want to build a course for people who want to get into this, who want to understand some basic terminology. What is a Kimura? What is an Americana? What's the difference between a bow and arrow choke and a guillotine choke? Because one's a disc problem and one's a facet problem. And how you treat those two things is very, very differently. And what
Hmm.
ends up happening is that an athlete will go in who got choked in a bow and arrow choke, and they're treated like a disc problem when in reality it's a facet issue. And
That's
so it makes a big difference in the outcome.
yeah, dude, that is awesome. Okay, you're gonna have to
Yeah.
repeat and where that can basically be found.
Yeah. Yeah. So the course is Northeast Seminars, NES. Just simply do Google my name, treating the combat athlete. It should pop up and take you directly to that. It's through Northeast Seminars. It's the same company that does all of Kevin Wilkes and Mulligan's courses. I do all my courses through them, my BFR course, my AMI course, and then of course this one. Um, but it's a very introductory course.
Hmm.
I also have a exercise program that goes along with it. It's if you go to my YouTube channel, it's the Vector Warrior Resiliency Program. It uses the Kaizen Vector. It's a piece of exercise equipment that I partnered with to create a injury prevention program specifically for Brazilian Jiu-Jitsu and combative training. So part of my goal with that program was that a lot of the things that we do in Brazilian Jiu-Jitsu are the same things that they're doing in defensive tactic training and law enforcement,
Hmm.
and the same things that they're doing in combative training in the military personnel. And so a very common mechanism of injury for law enforcement and for those in the military is defensive tactics training. And so this program is designed to help to mitigate the risk for those types of injuries during very aggressive training. I
Hmm.
mean, as a law enforcement officer, you are trying to take a suspect to the ground to effect an arrest, put
Hmm.
handcuffs on him. And so that's a very forceful and it's a very explosive and it's a very physically demanding and violent event. Combative training is a very violent event.
Hmm.
Brazilian jiu-jitsu training is a very controlled violence,
Hmm.
and so you have to prepare the body for that. And
Hmm.
that's what the program's written around.
Okay. So if you had someone who's never, so like myself, for example, I've never done
Yeah.
any kind of martial arts, Brazilian Jiu-Jitsu. Um, what would be like like a good, like I guess if you're walking into a gym, what are some signs that this is a good gym to start with?
That's a great question because, when I started training, again, I started training 12 years ago. It was still very, Brazilian Jiu-Jitsu, the origins of Brazilian Jiu-Jitsu, most people think came from Brazil, but it actually came from Japan. And it was a form of hand-to-hand combat.
Mm-hmm.
So the origins of it is a very violent sport, right?
I
And so when the Gracies took it to Brazil,
was gonna say.
they exactly when the Gracies took it to Brazil, what they did is they had these things called circuses.
Hmm.
And if you ever saw the movie with Jean-Claude Van Damme where he did the underground fight sport,
Hmm.
it is very similar to that. What they would do at these circuses is they would invite martial artists from all over the world to come and try to beat their Brazilian Jiu-Jitsu people. And then if someone beat him, what they would do is they go back to the academy and they would train to beat that martial art. And then they would have their circus again next year. So the art had constantly advanced. That's why it takes so long to go through the belt system. But it was constantly advancing, but it's also, the origins of it's a very violent sport.
Hmm.
And so, when you came to the US, you had the original Brazilian Jiu-Jitsu base that was, that unfortunately turned a lot of people off because, if I were to be a fighter, that's great, but I'm an IT guy or I'm a physician or a lawyer, right? I can't be breaking myself all the time. And so, so that goes back to your question, like, how do you tell a good gym? Number one is if you walk into a gym, if it's an established gym and
Hmm.
there's not a whole lot of upper belts, there's a problem, because what's happening is that people get up to a blue belt and they're like, I'm out of here. Like, I'm getting injured too much. I can't continue to do this, because it takes 2 years to get a blue belt.
Hmm.
So, typically if you're seeing a gym that's established, that has a lot of lower belts, but not purple belts, brown belts, and black belts,
Hmm.
that there might be an issue there.
Hmm.
If you look at the reviews and you see that people are saying a lot of stuff about injuries, you want to stay away from there, because it's not controlled chaos.
Hmm.
We are very specific about the training that we do here,
Hmm.
because we always tell each other, you don't break your training partner. You break your training partner, game over. Like, you don't learn and they don't learn. So the
Hmm.
idea is for longevity. So if you're going to a gym, what I encourage people to do is go scope it out. Sit and
Hmm.
watch one time. Next time, if you're not completely turned off, next time go and try a class. See how they bring you in. Do they introduce themselves? Do people come up and shake your hand? Do other people aside from the business owner come up and introduce themselves? Because
Hmm.
that tell you a lot about the culture. And
Yeah.
then how many upper belts are there? I was in our class this morning. We had close to about 25 people in our class, and we had 6 black belts on the mat. So that's very unusual. But our gym, we have 30 black belts. I mean, it's unusual, but it
Hmm.
goes to the culture. Our culture, when anyone comes in, somebody new, I
Hmm.
always, as a black belt, I go up and introduce myself. I make sure that they know what the process is, what they're going to be doing for the day.
Hmm.
And then I will usually pair up with them. So I'm not going to put them with some spazzy white belt that's going to try to choke them out all the time because they're new. What I'm going to do is I want to make sure that they learn something that first day. You know what I mean?
Yeah.
So it's really, listen to your sixth sense. So if you walk in to that situation, I don't know if you've ever read the book Blink, but it talks about tapping into your intuition,
Hmm.
which is really, it as a clinician, if you've never read the book, it's a really good book, because it helped me a lot on medical interviews about keying into your intuition.
Hmm.
But keying into your intuition, if you go in there and you just got this sense like, not so sure about this place, then don't do it. Because the last thing you want to do, especially, doesn't matter how big you are. I mean, I'm 5'7", and I've thrown some, 6'5", 295-pound dudes over my shoulder and humbled them in very big ways. So it doesn't matter how big you are or how strong you are.
Hmm.
Last thing you want to be doing is going into a gym where they're just gonna use you as a training dummy, for lack of better terms.
Okay. No, those are all great points.
Yeah. But the other thing is, though, too, is that, as a physical therapist, you should, if you're wanting to get into the sport, you
Hmm.
should go meet your local gym. You should go take some classes at your local gym, just so you get a better feel for what you're actually going to be treating.
Hmm.
Because you can't treat somebody who trains jujitsu if you've never been on a mat. I feel like that is a necessity. Like, how do you treat a CrossFitter if you've never done a snatch or a squat? How do you treat a football player if you've never thrown a football? Right? So there's certain, there's and especially with jujitsu, because it is there's so much wear and tear on the body, and how
Hmm.
you do it. And it depends on what kind of game you have. Are you a guard puller? Are you more of a wrestler? Which your game is also going to dictate what kind of injuries you see.
Hmm. Wow, that's a lot of insight, man. Dang.
Yeah.
But now it makes me want to give it a shot. So, Adam, if you're listening, now I want to come with you.
Yeah, it is. I will tell, and for PTs especially, because we all tend to have a little bit of a type A personality.
Hmm.
I'm just going to tell you, you will be highly addicted. because it is a highly, highly addictive sport for type A personalities.
Huh.
Because we often refer to it as human chess, because you're constantly not only, and what I'll say is that it has done so much for me clinically, but
Hmm.
it's also changed my life because number one, you will learn at some point that you need to calm down under extreme stress.
Hmm.
When you've got a 270-pound person on top of you, taking all the air out of your lungs as they are trying to choke you, you have to remain calm. So there's a mental piece to that, and I hate to use that example, but it's true. Like you
Hmm.
have to be able to calm yourself down and not spaz out and think through the process. And
Hmm.
that is absolutely thinking under extreme fatigue and extreme stress is
Hmm.
extremely powerful. Extremely powerful.
Gosh, that sounds like it sounds like
Yeah.
fun. I mean, I'm not gonna,
It
I'm a little
it's addictive.
anxious, but it sounds
Yeah.
like
It is so fun. It's absolutely.
so then finishing up here because we only got a few more minutes.
Yeah.
In terms of work-life balance, so like
Mhm.
you have a wealth of experience and you've been in the field for a while. So what
Yeah.
would be like just a message to maybe some of the newer physical therapists who just came out of school and the very, may just passed their
Yep.
boards and are kind of going through
Yeah.
the years of their first year in practice? What would you maybe give, like maybe just little bits of advice for like work-life balance?
Yeah. So often, I see on social media where PTs will blame their employer for the situations that they're in. And unfortunately, what people don't understand sometimes, I think, is the economics of PT.
Mm-hmm.
The economics of PT, and the reality is, since I started practice, our reimbursement has decreased 40%. Every other cost has skyrocketed and reimbursement has decreased 40%. That's atrocious. It's not a winning business model. And so what companies have to do in order to counter that is you have to see a higher volume. And it's not the employer's fault. It's a broken system. All of that said, I hear PTs also that will say, I don't get enough ACLs. I don't, I can't build an ACL practice. What I will tell you is that you can build any kind of practice you want. What you have to do is you can't just expect it to come to you. You actually have to go and do something for it. And
Mm-hmm.
so, when I hear PTs tell me that, I can't build a sports medicine practice or I can't build an ACL practice, my first question is that when's the last time you pulled a research paper? Like how much are you staying up on the current research? Okay, so now that you do that, what do you do with that information? Like how is that impacting your clinical practice?
Mm-hmm.
And then number three, what are you doing to go out to your community and educate your community about that? Like that business is not just going to come to you. An orthopedic surgeon who does ACLs, who has his own PT, is not just going to send you his ACLs. You got
Mm-hmm.
to earn that. And how you earn that is through persistence and constantly being persistent in what you want to achieve. I was telling my son this the other day because I was telling you my son's going into PT school.
Mm-hmm.
And what I told him is I said, I have my CV. That's what that I'll send for people for courses or whatever, or a job or whatever. And then I have my future CV. My future CV are all the things that I want to achieve. And what I do is I write up what that goal is. Like I
Mm-hmm.
wrote up the athlete lab. I wrote up what the athlete lab was going to be, that I was the owner of the athlete lab, the founder of the athlete lab, and what the athlete lab was going to do. And I've done that with every single thing that I want to achieve
Mm-hmm.
because number one, I think if you articulate it on paper,
Mm-hmm.
and you describe it and then you put some substance to it, then you can break down and say, okay, how do I get to this part of it and that part of it and that part of it and that part of it? Then it helps you kind of drive your goals towards where you want to be.
Yeah.
But I became very determined that I was going to be known for ACLs many years ago. It took me a long time to get there.
Hmm.
I became very determined that I was going to be known for treating combat athletes,
Hmm.
and it took me a while to get there. Doesn't come overnight, but you got to be persistent. Just got to
Hmm.
be persistent.
Good,
I don't know
good.
if that answered the question or not, but my two cents.
No, I like it a lot. Um, how about more along the lines of balancing work and then the joys of
Yeah.
outside of work?
Yeah, I will tell you, I think for anybody who's driven in our profession, that's always a hard balance. And it's a balance that, quite honestly, I struggle with all the time.
Hmm.
I'm very fortunate that I've got my wife and I've been married for 32 years. I've got a very strong woman in my background
Hmm.
who helps me keep that balance. She lets me know when I'm getting outside of that balance. Um,
Love it.
the other thing is too is that she helps me schedule. If we're gonna go on vacation, she's like, I'm putting this on your schedule. So she helps me balance that out.
Hmm.
I think as a driven individual, type A personality, it's a really hard thing to do. For me, fitness has always been a big part of my life.
Hmm.
I don't know if I have that life balance, but my morning starts at 2:45. I get up, I go to the gym at 3 o'clock. I train, and then I go to start jujitsu class at 5:30. That goes till 7, and then I take a shower and I head off to work, and I'm usually done by work by 4:30, 5 o'clock. And then I get to see my family. Um, my kids are older, so, I don't have to spend a whole lot of time in the morning, getting them ready for school and things like that. I've got a 23-year-old and a 19-year-old. But also, I'm very cognizant about dedicating that time to my marriage, which is super important. Because if mom's not happy, nobody's happy. And then being there as a dad, I absolutely, the time that I'm with my kids is the quality time. I'm not on my phone. I'm not on social media. I'm not scrolling. When we're having a conversation, he puts down his phone. I put down my phone. Ear pods come out of his ears, sets him down, and we actually have conversations. I think that there's so many distractions today
Hmm.
that part of that life balance is getting away from social media, because
Great.
if you took every minute that you spent on social media and applied that to your family, that's huge.
Good points, man. Very good points. Dang. No, but unfortunately, I wish we could go
Yeah.
longer. I'm not gonna lie, but
Yeah.
that's all we got time for today.
Yeah.
But hope everyone enjoyed the discussion here with Dr. Trent Nessler. I really appreciate you coming on here today.
Absolutely.
I thoroughly enjoyed your wealth of information. Maybe I'll bring you back.
We'll do it again.
Let's do it again. But
Awesome.
we will see you unless you have anything else you wanted to talk about real quick.
No, no, you just for your listeners out there, if you want more information, feel free to check me out on Instagram. It's
Mhm.
BJJPT_ACL guy. I do post a lot of good stuff on there, or you can always go to my website, which is theathletelab.org.
Mhm. And I'll put those up on his post too when we put the
Awesome.
episode out. All right.
Cool.
Awesome. Well, then, guys, we will see you in the next episode. Have a good one.
Thank you.